निधि मेरा 9 इयर्स की है और 6 इयर्स में प्रॉब्लम शुरुआत हुआ था इसका। थाई में पेन बोल के बोलती थी। फिर हमने डॉक्टर को बोला पैर बहुत छोटा हो रहा है ये पैर से, तो उन्होंने एक्सरे किया था। एक्सरे करके फिर उन्होंने बोला अभी उसका पैर बचा नहीं सकते। मैं हिम्मत जुटा के मेरे बच्ची को आगे लेके जाऊंगी, सबसे स्पेशल रखूंगी सर मेरे बच्ची को। सब देखे चलो, निधि को देख के सीखो, ये चीज़ मुझे चाहिए सर।
The story of Nidhi and her mother exemplifies the human spirit to overcome hurdles in life. Cancer did not deter Nidhi and her mother from pursuing Nidhi's goal of becoming a swimming champion. The Indian Cancer Society's Cancer Cure Fund relieved them of the financial burden of finding the resources to meet the cost of Nidhi's treatment. The Indian Cancer Society has similarly helped more than 11,000 patients and their families in finding the resources for treatment, and thereby many of them have been able to return to productive lives and pursue their goals and aspirations. All this would not have been possible but for the support that we have received from the HDFC Asset Management Company and other corporates. In just a decade, the Cancer Cure Fund has grown tenfold from 200 patients per annum 10 years ago to more than 2,000 patients in the last 2-3 years. And we hope to touch 3,000 patients very soon.
Now, it's a unique story because no one would associate a fund with an NGO, a not-for-profit organization, which has to fight for day-to-day survival. ICS itself is a unique institution set up 70 years back to fight cancer in India. In an era of disruption and black swan events, organizations tend to age and die, especially NGOs, who often do not last their own founders. But ICS today is 70-year-old. Because of the spirit of innovation and collaboration, which has continued to define the character of ICS till date. In the 50s, ICS set up the first cytology and chemotherapy units in India in collaboration with Tata Memorial Cancer Hospital. In the 60s, it set up the first screening unit, a private population-based registry, and India's only index journal of cancer in collaboration with ICMR and other onco institutions. In the 70s, it set up the first rehab center for cancer patients and went on to set up a survivorship program for child patients. Later, it promoted 2 cancer hospitals in India, one in Delhi and the other in Mumbai. Recently, it has also embarked upon, on an all-India basis, an awareness program through print, TV, and social media in collaboration with various media houses in the country. It has started a 40-module e-learning course in collaboration with the University of Delhi. And it has set up a unique online video-based advanced medical education program for general practitioners. But its most audacious initiative had been to help launch in 2011 with the collaboration of HDFC Mutual Fund and Tata Cancer Hospital, the first mutual fund for providing funds for cancer treatment for the poor. But then out of adversity came the best ideas. So in a brainstorming session, we did some lateral thinking and asked ourselves whether we can apply the concept of mutual funds to mobilize funds for cancer treatment with an all India footprint. Over to Milind to take you through the rest of the ICS CCF story.
Our story today is about the Indian Cancer Society and HDFC Association in launching the very unique financing style for philanthropy through a mutual fund product, which is launched by our asset management company way back in 2011. So it goes back to the time when we were completing 10 years of our existence in business. And to commemorate that event, we wanted to do something which was philanthropic. We had a few discussions with the representatives from the Indian Cancer Society. We understood what Indian Cancer Society, or for that matter, any philanthropy or any NGO really requires. And we came back from the meeting, a few meetings later, understood some of the real essence of what Indian Cancer Society was looking for was not simply more money in the form of donations, but something which was sustainable in the way the donations occurred year after year over a long period of time. So the key that we took back from those several meetings was that sustainable funding was the need of what Indian Cancer Society needed to pursue this program of financing by free medical aid for people afflicted by different forms of cancer. What we came up with, and which turned out to be very innovative and unique in the way it was designed, is that we actually created a mutual fund product, or as we call it, an investment product, by which we could access investors' money into a pool of mutual fund product, which had the investment objective of investing in very high quality debt paper where principal was assured. And what we created is a feature where the income that we would have normally distributed through the product to our investors would, instead of being distributed to the investors, would go to the donee, would go to Indian Cancer Society as a donation on behalf of our investors, not us. I do hope that other asset management companies and other companies in the financial industry also come up with similar or innovative products whose objective is to finance philanthropy so as to create a channel between savers and investors and philanthropy.
Cancer Cure Fund supports patients through empaneled hospitals. There are 18 hospitals that have been empaneled all over the country on the basis of a very rigorous due diligence to ensure that they meet the criteria which has been laid down in the Cancer Cure Fund guidelines. These include providing diagnostics, surgery, radiation, and chemotherapy in the same hospital, adopting a patient-centric approach by waiving doctors' fees, surgeons' fees, theatre charges, bed charges, and the like, and providing a full utilization report on each patient, and providing the Cancer Cure Fund as the present status of each patient after a follow-up. Indian Cancer Society's Cancer Cure Fund continues to empanel hospitals all over the country, particularly in the underserved regions. The empaneled hospitals are our most important partners in our journey of saving lives through in the Cancer Cure Fund.
We at the Tata Memorial Hospital have been associated with the Cancer Cure Fund right from its inception for more than 10 years. And we've had several thousands of patients from many Tata Memorial centers which have benefited from this initiative. At Tata Memorial, we believe in bringing quality cancer care to the doorsteps of patients. And we have developed 8 such institutions in different parts of the country so that patients do not have to travel long distances to access care. Many of these hospitals are empaneled under the scheme, and we are hopeful that in the near future, the remaining hospitals will also get empaneled so that patients can get benefit from this initiative. In addition, we also coordinate the running of the National Cancer Grid, a group of over 270 cancer centers brought together with the aim of providing uniform standards of care at the doorsteps of patients. So between these different initiatives, we are hopeful that the time has come for patients to be able to access care close to their homes at a cost which is affordable, and money need not any longer be a constraint in the provision of high quality cancer care. The model that the Cancer Cure Fund has initiated is something that could be replicated by several other organizations in the field of trying to help patients get quality care at an affordable cost.
Thank you. We are a not-for-profit cancer center located in the eastern part of India, in a town called Silchar in the southern part of Assam. We have 140 beds and we see about 4,000 to 5,000 new patients every year and about 25 to 30,000 patients on follow-up. Most of our patients work for daily ages and a majority of them earn less than rupees 60,000, which is about $750 every year. 80% of them have large families, often with one earning member, and they live in kacha houses, which are, subject to ravages of weather. Many parts of the region are very difficult to travel, and even we as healthcare personnel, when we go to their homes, we have to travel through precarious bridges and boats and wade through water oft times. The Indian Cancer Society started supporting the Kachar Cancer Hospital through its Cancer Cure Fund from 2016, and they were one of the earliest agencies to provide support in the region, which enabled many patients to access cancer care nearer their homes. It increased the access to expensive but impactful drugs like trastuzumab and rituximab. What is important for us to understand is, if the support from the Cancer Society was not available, many of these patients, their chances of survival will be very low because they do not have the resources to travel elsewhere for treatment. And therefore, the support from Indian Cancer Society starting in 2016 has been very, very timely. Over the years, they have supported over 300 patients. Our patients are very grateful for the support from the Indian Cancer Society. Thank you.
The process of patient enrollment starts with a few mandatory checks by the treating hospital. The income of the family, the patient's family, is assessed and it should not exceed more than 5,000 US dollars per annum. The treating doctor then makes an assessment of whether the patient has at least a 50% survival chance beyond 5 years from treatment. And with the details that the hospital provides, the data is sent to the Cancer Cure Fund. After verifying the application, the Cancer Cure Fund team captures the patient's detail in the Cancer Cure Fund web-based software while ensuring full data privacy. Prior to 2020, all the applications received by the Cancer Cure Fund were manually evaluated by the due diligence team, having weekly physical meetings for at least 1 hour where they evaluated each application and made their recommendations. Over now to the doctors to take you through the journey of using an artificial intelligence tool for evaluation of patients' applications.
I've seen the number of applications for funding rise exponentially. What began as a modest 267 applications in 2011 were more than 2,300 applications in 2018 itself, and are incessantly growing. The onus to review each of these applications lies on the due diligence team, not only for the appropriateness of diagnosis, cure rates, cost of treatments, and sometimes the treatments itself. It is a rewarding exercise, but extremely time consuming. And over the years, we found it difficult for oncologists to give us adequate time as well as attention for the increasing cases. And that is when we sought help from AI.
Hi, this is Dr. Naresh Ramarajan with Navya. Navya is a cancer informatics and a patient services organization We use data to provide personalized evidence-based cancer treatment plans to patients and treating oncologists in India as well as internationally. Navia has been working with Tata Memorial Center and the National Cancer Grid since 2012 to build technology that would actually be useful in treatment decision-making and treatment planning for patients. In 2019, we started collaborating with the India Cancer Society to leverage our technology towards a scalable decision process. And in 2020 and 2021, we actually did a parallel process where we sent all of the applications that India Cancer Society was funding through the Navia technology system, as well as processing it through the DDT. The results of it were presented at the Society of International Oncology for Pediatrics, which I'll walk you through in a minute. To date, in 2022, we've processed over 4,000 beneficiary cases through the Navia system in order to assist with the ICS mandate of funding cancer care for patients across the country. So how does it actually work? When we get an ICS beneficiary application, we get the raw medical record with a lot of unstructured data in it. This then comes into our system and it immediately starts getting annotated and structured. What's the age of the patient? What's the gender of the patient? What's the stage of the patient? What type of disease is it? What are the comorbidities? What were the previous treatments? And then once we have that structured case summary, we're able to then match it with the international randomized control trials, with the guidelines to be able to generate a prognosis and a treatment plan, as well as to see what's missing in the diagnosis. And we're also able to look at our experience engine, our 4,000 ICS cases, plus the cases that are similar that we've worked at with Tata Memorial Center, to be able to generate whether it matches ICS funding criteria on prognosis and on other criteria around the patient compliance, et cetera. With that, we're able to actually generate a decision of two kinds. One is this patient likely to secure funding from India Cancer Society? And the second is, are there anything missing in the diagnosis and treatment plan which needs to be communicated forward to the treating oncologist and therefore onwards to the patient? We were able to present this data at the Society of International Oncology for Pediatrics as a scientific presentation. And we were able to show that of the 411 pediatric patients that were simultaneously reviewed by Navia as well as by the DDT at the time, almost 80% of the cases were able to be assessed by the Navia engine alone without escalation to the experts. 100% of the time when we assessed it by Navia alone, 99.7% of the time, there was concordance between the ICS decision and the Navia decision. And get this, on average, we were able to save per expert who was volunteering their time to assess pediatric cases. These are experts in the country in pediatric solid tumors, liquid tumors, which are extremely rare, who are volunteering about 30 minutes of their time to be able to assess these funding decisions. We were able to save that for the experts and move that back into research and patient care. So we've learned a lot of things through our partnership. The first is you can actually leverage technology in an intelligent, solution-focused way to be able to deploy it in mechanisms of claims processing, beneficiary benefits checks, et cetera, that actually allows us to stay concordant with cancer experts at a very deep level and return results very quickly, at the same time saving expert time, which is extremely valuable. And most importantly, what we're building is a rapid learning and training system so that if there's a decision, a discordance that we learn through this DDT process where we readjust a case, we're able to go back in the future and keep reducing that amount of cases that we're sending to DDT. So it's a learning and a training system.
Patient applications that meet the ICS CCF criteria are recommended and directly forwarded to the GSE, whereas complicated cases are referred to the due diligence team. The due diligence team comprises of expert oncologists and they meet every week. As majority of cases are referred directly to the GSE, very few cases have to be reviewed by the DDT doctors, and this saves a lot of precious clinicians' time. Every patient application is then reviewed by the GSE, which meet every fortnight. GSE comprises of expert oncologists, leading finance and corporate professionals, as well as Indian Cancer Society trustees, who are the final authority to sanction an application. With the help of empaneled hospitals, the GSE and DDT, we have been able to formalize and cap the cost of certain treatment protocols, which is considered while sanctioning an application. We are proud to say that our turnaround time from the time of the receipt of application to the actual sanction is around 14 days.
Once the application is sanctioned, a significant part of the cost of treatment is met by the Cancer Cure Fund, thus enabling the patient and the family to focus on the treatment itself.
Cancer Cure Fund, through its empaneled hospitals that we learned about, through technology, and through a very transparent process, is in a position to ensure that no patient who has a treatable cancer suffers or dies for want of funds. And that's where this whole process has been so beautifully orchestrated by CCF. As a result, we are able to now follow up on these patients, ensure that they get standard of care which is required across the length and breadth of the country, and the most efficient manner. And that, for me, is a very, very important accomplishment of Cancer Cure Fund.
Today in India, the government programs for healthcare cover a significant part of the cost of illnesses, of most of the illnesses. But nevertheless, in the case of cancer, there are a significant percentage of the population who still cannot afford the cost of treatment. And for certain drugs and for certain kinds of treatment, the coverage is not available. This is where the Cancer Cure Fund provides a very useful source of funds for hospitals who want to see their patients get cured. The Cancer Cure Fund is an innovative, robust model to get the best outcomes for the cancer patient and society. It is capable of being replicated, and we are totally open to sharing this model with any organization which wants to replicate it and increase the outreach for cancer patients. Truly, we are committed to making a difference in the lives of cancer patients.